Welcome to HYBIZ News. My name is Suresh Kochattal. Ever since the pandemic COVID-19 hit, hospitals across the country and the world have changed the way they work. Surely, we changed that move from the physical doctor to a virtual doctor. And surely, technology is here to stay. Apollo TeleHealth is one of the leading players in this segment. And talking to us today is the CEO Apollo TeleHealth, Vikram Thaploo. Welcome to the show, Mr. Vikram Thaploo. Can you talk about how the world has changed since the lockdown happened here in India? Because before this, we were used to going to hospitals, meeting doctors face to face, and unless you saw the doctor feel and touch you and write a prescription, your visit was not complete. How are things now?
Well, I'm here to talk about the healthcare delivery before and after the pandemic hit us. Before the pandemic, I think though we were ready, telehealth had been taking some shape. It was already taking, remote healthcare was already in the hands of people, mobile apps, laptops, computers, all of these have been used widely in the last 10 years. But after this pandemic, the way people have started looking at telehealth has completely changed. The way people have started using technology has completely changed. Everything has become virtual. Everything has become virtual, right from the meetings to cooking classes to yoga, and so is it with healthcare. During this lockdown, the bigger problem has been not only the corona, the problem has been people who are suffering from conditions apart from the disease itself, like for example hypertension, diabetes, and many other comorbid conditions. So for them, technology has been a boon. Telehealth has been the only way they could probably reach out to their doctors. And surprisingly, all the doctors are not completely fighting corona. They are in different places. Their OPDs have been shut down. So virtual OPDs have become the name of the game today. And thankfully, we at Apollo were ready for it. We have been doing telehealth for the last 20 years and aggressively for the last 10 years. Numbers have increased. Virtual consultations have gone twofold, threefold in the last 15 days. It has put everything under stress, but at the same time, it's very patient centric. People are able to understand that what they were resisting earlier, now the resistance is gone. The way other technologies or other tools were used comfortably by people, for example, when WhatsApp came, and today I think no messaging is as popular as WhatsApp. So I would think and believe that in times to come, remote healthcare will be the way people will like to take their healthcare services. Hospitals would only be used when a physical intervention is required.
Can you let us know in terms of how technology really works in this field? I mean, at least before Corona, how was this all about? How did the technology work into creating, kind of reaching out to places and treating people virtually?
See, of late I have been seeing some messages about BC, before Corona, and I think we'll now see a world after Corona. Technology has time and again been used, and I think what's more important to understand is there are times like these which change the thinking. These are times like these which probably make you adopt to a new system. I remember reading an article which was about the use of metal detectors. I think before we started getting terror threats, metal detectors were not used much often. But after that happened, I think metal detectors today are a norm, whether you walk into a mall or whether you walk into an airport. Going forward, I think this is going to be the way people will embrace technology which has been used in remote delivery, whether it is healthcare or whether it is virtual meetings. I think we as a company are also looking at virtual meetings much more often now. I think the resistance which people had towards having virtual meetings is almost gone, because now every day we have all virtual meetings. I think 3 to 4 meetings a day which are happening virtually. So probably it would go towards a time when people will use less of travel, less of transport, less of airlines. I would suggest that if we do that, we'll probably bring down the carbon footprint of each one of us. I believe the technology is here to stay. It may see a little dip, but it will take off again. It will not go back to what it was before this pandemic.
Can you give us one example of how remote healthcare or telehealth was used to kind of reach out to a patient and help them reach out to and get access to quality healthcare and save many a life?
So, remote healthcare has evolved right from doing a physical interaction, or probably it has evolved from where primary consult was given over telemedicine to EICU management on tele to doing tele-emergency. We have been able to save close to 1,000 lives in remote parts of Himachal Pradesh where we run tele-emergency centers, and those areas are in Lahore and Spiti, Chamba, where probably the connectivity is as bad as you can't go there during the winter season. And that's how I think in the recent times also we have been able to save a MI patient because the heart attack was bad and there was no travel possibility. Snake bites, skull ruptures, fractures, we have been able to kind of stabilize many patients using tele-emergency. Tele-ICU is very naturally being used by many hospitals, many systems. That's a norm of the day because on two sides. On one side there is a lack of the trained doctors, the intensivists are not available everywhere, so emergency specialists are not available everywhere. At the other side, I think issues like travel, issues like spending a day or 2 or 4 traveling to a hospital and getting not being able to get your daily wages. So all these put together I think have been the shot in the arm for telehealth as a system of delivery of healthcare. Telehealth does not kind of go towards where telehealth does not need doctors. We need doctors. We are not eradicating doctors. It's just a methodology of kind of delivering the healthcare services and probably reaching out to masses much more and much better.
Thank you very much, Mr. Vikram Thaploo. Thank you for speaking to us. I know you have a hectic schedule, but it was a pleasure speaking to you and understanding how these things work. Thank you very much. This is Suresh Kochatal here, signing off for HYBIZ News.